Okay, the time is 7:59 and you're counting down the seconds. 3, 2, 1. And then you're on the phone. Oh, hello, you're through to Blank Medical Center. You are number 56 in the queue? Devastated. Like, how does this happen? The chances of you having an appointment before those 56 people are done is minimal. And yet this is the experience of many patients across the country at the moment in the NHS. 47% of people now do not find it easy to contact anyone at their GP practice. And the reason for this fundamentally is that we are losing GPs. We lose one GP every single day because the job has just become undoable. And given that every GP delivers about 5,500 appointments over a year, that's over 5,000 appointments lost from the NHS every single day. Yet despite the existing doctors, nurses, practice staff working tirelessly behind the scenes, demand is still going up, with patients needing an extra 35 million GP appointments between 2021 and 2022 compared to the 3 years prior. Now, practice staff may be working exceptionally hard at the moment, but that doesn't necessarily help you, who may still be struggling to access healthcare when you or a loved one need it. If that's you, then what do you do when you can't get through to a GP appointment? My name's Dr. Tom McRide, I'm a GP based in the NHS, and today's video is going to be covering what to do when you can't get a GP appointment. The first option we're going to take a look at then is the NHS app. This is the front page of the NHS app, the home page, and I tend to navigate it using the banner of icons across the bottom, so that's where we'll start. If I go into the advice icon, then you can see I can find some information on coronavirus. I can also go into the conditions and treatments page, which is an A to Z list of different conditions from the NHS. And this is a great resource if you've got questions about a particular condition, or you want to know how it's tested or investigated or managed. You don't have to go to your general practice for that. You can find that kind of information within the A to Z page. Just go back to the advice page. You can also see NHS 111. You can access it from this page. We'll cover that a little bit later. And then finally, ask your GP for medical advice. So not all surgeries will have this active, but this allows you to access online consultations. These are services where you go through a series of different questions. Here we go, it's bringing up a page in the NHS Now, which will explain how online consultations are worked. And it's basically a form that you fill out online, answering a few questions about the symptoms that you're experiencing. And then you submit that to your practice, and your GP might decide to bring you in for an appointment, or they might just call you up, or maybe send you some advice by text or email. So again, it's another route into seeing your GP. I think unfortunately when I tried this earlier, my practice wasn't set up for online consultations. There we go, so not every practice is able to access that. If we then go to the appointments button along that banner at the bottom, you can see that I can actually book some GP appointments. If I click up here, let's just let that load. So this will allow me to book a regular appointment with my GP practice. It's a great alternative to spending ages in the queue on the telephone. Every practice in England now has some appointments they've put aside specifically for online bookings. So I would encourage you to check that out, and you can book telephone or face-to-face appointments through that. You can also click on this hospital referrals page in order to track any referrals that have been made to the hospital. So if you haven't heard from the hospital for 6 or 9 months after your referral's been made, rather than contacting your surgery to say, hey, where are we up to, you can find out for yourself. And to be honest, this is better than anything that GPs have access to anyway. I don't have any system where I can see where patients are in the waiting list. This is better than any of that. If I go to the prescriptions tab, this allows me to order my new prescriptions. So I can order anything that I've had as a repeat prescription. I can click on there, and I can also change the pharmacy that gets sent to. And if I go into Your Health, this allows me to check my own health record. So this is particularly useful. I see some patients that come into the practice, perhaps their employer wants to see proof that they've been ill or they have a medical condition, or perhaps they need to show evidence of the vaccinations that they've had. You can get all of this information here from your GP record. And then finally, if you go into the Messages tab, you can see here there is the ability both for the practice to send you messages, so they might be notifications that you've got a review appointment that's due, or information about coronavirus or local outbreaks, but you can also send simple requests to your practice. These are a bit like those online consultation forms, but a little bit more simple. So if you've just got an administrative query, something like, can I extend my fit note for an extra week, or can I have a letter for school to say why my child was off, you can send an electronic message through for the practice. This tends to use the same software provider as those online consultations, so as you can see, if your GP is not set up for it, you can't use that, but I would definitely take a look at that if you just got a very simple query you need to send in to your practice. The next option is to have a think about online tools that can help you maybe reach a diagnosis, or better, tell you where to go to get the help that you need. Things such as the Ada Health online AI tool or NHS 111 help to take your symptoms and then offer you an idea about the urgency and where you can go to get help. I've covered these in a previous video. If you check out my video, Should I Google What's Wrong With Me? That'll give you an overview of some of the tools out there, so I won't cover that again in this video. I'll include the link though for that one in the description below. Next up is there are a range of NHS services that you can actually access without needing to see a GP first. Pharmacists, as well as giving advice on your medications, can manage most minor ailments, including sore throats, coughs and colds, earaches, urine infections, but also constipation and migraines, and there are a range of different medications you don't need a prescription for treating these. Physiotherapists, now there are physiotherapists available in most GP practices across the country, and you can book in directly with these. The advantage is that a physiotherapist will have far more time with you than a GP and are specifically trained to support you with muscle, joint or back issues. That includes issues such as sciatica or trapped nerves or neck pain. And finally, if you feel that you have a mental health condition and you're having a crisis, so perhaps you or a loved one are having dark thoughts about self-harm or even suicidal thoughts, then you can seek urgent mental health through urgent mental health treatment teams. Just Google Urgent Mental Health NHS, and that will take you to an NHS website where you can search for the contact details for the nearest urgent mental health team for you. In addition to these, if you've got a problem which is new and urgent enough you need seeing today, but not so urgent you need to go to accident and emergency, then you could visit your walk-in centre, and you can find your nearest one online. If I just type in NHS walk-in centre, there we go. Here we go, this is what I'm after. Find walk-in centre services. So this is the first page that comes up on Google. And if I search in there, I can just type in my hometown. So I live in Chester in England. And if I search that, here we go. It'll reveal the nearest walk-in centres for me. Now, none of these are close. None of these are kind of actually in Chester. But if I had a condition where I needed to be seen the next couple of days, let's say I've got a high temperature and a sore throat, I need to be seen. It's not an emergency that needs A&E. I can't get into my practice for the next week. I would be prepared to travel to one of these options if it meant getting treatment sooner. So I can just click into any of these. You can see they're ordered by how close they are. And I can find out information about their address, their number, and their opening times as well. And you can see for walk-in centres, they tend to be open over the weekends and in the evenings. So again, a great alternative if I'm struggling to get into my GP surgery. The final option I'm going to cover, and this won't be applicable for everyone, is to consider using a private online GP. Now, there are a huge range of different companies out there, and I've included some of the most popular ones in the description below. These providers tend to do their consultations remotely. That means by telephone or by video. That has the advantage that you can contact them pretty quickly and when you need it, wherever you are in the country. but the downside is they can't treat everything. It's therefore crucial that you visit their website and see what they can treat in a consultation. If you've got a cough or difficulty breathing, someone's going to need to listen to your chest, and they can't do that by phone. If you've got a problem with your sight, they'll need to look in your eyes. They can't do that by video. So make sure you know exactly what they can treat, because you won't necessarily get your money back if they can't treat what's wrong with you. The other thing to be mindful of is costs. Now, some of these providers, they'll do a kind of pay per consultation model. Some of them will do a subscription package where you pay for the year and you can access them how many times they want. Whatever model you go for, bear in mind that the costs rarely include the cost of the prescription itself. Now, websites might say, for instance, prescription charges included. That's usually just for writing the prescription. Going to the pharmacy and collecting the drug will cost money if it's done on a private prescription. And those costs can be 20, 30, 40, 50 pounds and above for a packet of medication that usually would be free or much cheaper on the NHS. So be aware of that. Finally, you want to make sure that the company is legitimate, and probably the best way to do this is to see if it's registered with the CQC, or the Care Quality Commission. This is an organisation that regulates all healthcare providers in the UK, make sure that they're safe, effective, responsive to their patients' needs. So if you can see that CQC badge, you can find an inspection report from the CQC, which will give you an idea about how good the company is, but you also then know that they're legitimate and they're regulated. That's it for today's video. Just to recap then, we've talked a little bit about the NHS app, a little bit about online tools that can help signpost you to the care you need, but that's more covered in another video. We talked a bit about services you can access without needing a GP appointment, like pharmacies and physios and mental health services. And we've also talked about some of the online private providers you can visit too. If you found this video useful, please share it with friends or family that might find it beneficial too, and make sure you subscribe to the channel. I'd really love to see those numbers get back. I'd love to hear some feedback from you on how you found the video. And if you are interested in more ways you can take a proactive, do-it-yourself approach to your health, please do follow this channel for more videos much the same. But for now, thanks for watching, and I'll see you on the next video.